it's important to highlight the mechanism of action of the agent and what happens with the transthyretin protein in a disease state. We know that the transthyretin protein is a 4-unit compound that can destabilize over time, either with age or genetic variant. But there is one protected genetic variant, the T119M variant, that increases the hydrogen bonds that form at the center of that 4-unit protein, such that it doesn't break down as much. And if the TTR protein can't break down from a tetramer to a dimer to a monomer, and then reform into a waxy amyloid clump and then invade the heart, that mitigates the disease process. So what Attruby does is it's based off of that biology of a protective variant to increase the hydrogen bonds at the center of that 4-unit tetramer.
Indication and important safety information. Indication. Attruby acoramidis is indicated for the treatment of the cardiomyopathy of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions. Diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.